Yeah, my name is Heraclio. I'm a Brazilian orthodontics. I graduated in dentistry in 1996, and then straight after that I went into ortho, and then I've been specialized in orthodontics for, I'd say, the last almost 20 years. And then I came to Ireland to learn English, and now I'm able to practice here in Ireland, and that's been 2 years now that I've been practicing dentistry and doing my orthodontics, which I love. When it comes to adult treatment, we can offer aligners, we can offer metal braces, we can offer cosmetic braces. It's all about what we can do, what the patient wants, and what he's up to in terms of results. When it comes to metal braces or cosmetic braces, fixed braces in general, I'd say the best thing for you to do is, if you're at home watching me, give us a call and come in for a free orthodontic consultation. At that appointment, I will discuss all the options. I will talk to you about time frame. I will talk about prices. I will talk about braces options for you, metal, clear, aligners, whatever you would like to know about. You can ask me as many questions as you want. We can show you results that we have similar to your case, and we can go through all of your questions, okay? The first thing would be that. Second thing would be get an x-ray for us to assess the roots and the bones that you have, and check for decays and check for any dental treatments that you have to do before the braces, or even a cleaning. We can do it all for you here in our clinic. And then we'll talk about the braces. Everybody can have braces, doesn't matter how old you are. There are things that we do on teenagers, young adults, even if you are like over 60. I have patients that are over 60 and they want to have a straighter smile. And why can't they have? Because it's a teenager thing? That is not true. You can have braces at any age you want. Time frame, braces can take up to 36 months in the worst case scenario. If we're talking maybe about a severe case that will need extractions to create space, that has a very overcrowded mouth, and then it can take up to 36 months. But most of the cases, they take about 18 months-ish. You'd be surprised sometimes we finish treatment even in less time than 16 or 18 months, okay? Metal braces, they are a bit faster than clear braces. So if time is an issue for you, you have to consider the option of going with metal braces. The procedure is very simple. After you have your x-ray taken, you come back for a second consultation, and then we're gonna take all the records we need. We're gonna take photos of your teeth, photos of your face. We're going to assess your x-rays. We're going to discuss the findings with you, and you're gonna let us know what you want, and I'm gonna let you know what I can and can't do. And that's one thing I'm very honest about. There are things in orthodontics that are undoable and unreasonable. But there are things, and you'll be surprised with some of the results we have, that just will make your life a lot better, because you'll be more confident with your smile, you'll be a happier person, and more smiley, and just better quality of life in general. When you have your braces on, what you have to do is come to your appointments, which are usually every 6 weeks-ish. And of course, your job at home is to take very good care of your braces. So you're gonna brush your teeth very well. We'll teach you how to brush. We'll teach you how to floss, or sometimes use interdental brushes instead of flossing, which may be handier. We'll teach you what you're allowed to eat and not allowed to eat. We'll give you all the information about emergencies with braces. If something breaks on you, if something slips off on you, what to do, you can just give us a call, pop in, we'll fix that for you at no extra charge or anything. So the first 2 weeks after you have your braces on, that's when all the things happen, because you don't know how to deal with the braces. After that, you will be grand and nothing else is going to bother. And actually, when you have them off, you find it strange not to have your braces in your mouth anymore. It's kind of funny, actually. And the benefits of the treatment: imagine yourself that don't want to smile because you are ashamed of your teeth position or the shape of your teeth or your smile line. It doesn't matter. Imagine how different would your life be if you had straighter teeth, brighter smile, and fuller smile, and all of that. So I think the benefit of the treatment speaks for itself. I think you might be wondering when to bring your kids to have their teeth checked for braces, right? It's very important actually to do that. I'd advise you to start looking into that at the age of 7, because that's when kids start losing baby teeth and changing from baby teeth denture to permanent denture. Especially if you notice your kids are grinding their teeth at nighttime, if they breathe mainly through their mouths instead of through their nose, if they have some biting or chewing habits that don't seem very normal, because intraoral habits can develop malocclusion, can develop kids' teeth in the wrong way, and that needs to be fixed. There are some things that we can do at the age of 7. For example, an expansion of the arch if your kid has a crossbite, for example, at the back. Or at the age of 10-ish, 11-ish, we can start working with the jaws, the lower jaw and the upper jaw. Especially the lower jaw, which is the bone that it's movable in our face. We can push that forward or slightly back or slightly sideways to get a better bite and a better cosmetics and aesthetics of your kids later when they're older. If you miss that opportunity when they are growing, it's very hard to achieve a very good results when they're older, because I don't have the growth to help me. I'll only be able to move teeth and I won't be able to actually move bones and help with the whole process of the bite settling for the kid. Treatment length can vary depending on what procedure we're going to do. When we treat kids, we don't treat everything all at once. We target spot, crossbite, overjet or overbite or intraoral habits, and then we treat those. So it can be somewhere between 4 months and a half to 6 to 8 months at most, okay? And then of course when they're grown up, if they need fixed braces, and then we can do as well the full comprehensive treatment at that age. We pretty much offer the whole variety of appliances in the market. Kids usually, when it comes to expanders, I personally like fixed expanders because I don't need the compliance of the kid. So a fixed, like a Hyrax or a Haas or a McNamara, for example, they are all different kinds of fixed expanders that will expand the upper jaw. Sometimes we need expansion on the lower jaw, and then we have to go for removable appliances. Sometimes we need a lower jaw advanced because the kid, for example, has an increased overjet or bite on their lips, for example, or have a tongue thrust or lip thrust or something like that, and then we'll go for a bionator or a twin block, which is removable appliance. So we can use a mix of removable appliance and fixed appliance, even sometimes brackets, the train tracks itself on a few permanent teeth to level and align them slightly before they are teenagers. If you'd like to become a patient, all you have to do is give us a ring at 01-878-6999 or email us to info@thefrederickdentalclinic.com, and you can check our results online as well at thefrederickdentalclinic.com and call in if you want in person to 33 Frederick Street North. We're based in Dublin 1, and you also have the option to go online and just on our website, thefrederickdentalclinic.com. Your first consultation will be free of charge. We'll assess your son or your daughter. We'll request an OPG, an X-ray, and we'll chat about treatment plan options for him or her.